there were two friends who were walking on the roads. One friend gets a seizure. In this seizure, he twisted his arm like this. In the seizure, which is a very common phenomenon. The friend who was ignorant about seizure, he said, "Oh my God, his arm is twisted." So in that unconsciousness, he untwisted his arm forcefully and displaced his shoulder joint. So because he had no idea what seizure can happen or what are epilepsy, he caused more severe damage to his shoulder joint, which is forever now. In simple language. But a single seizure does not mean it is epilepsy. Epilepsy means when you have two or more seizures, unprovoked seizure, then you call it epilepsy. One person had one seizure and after a few days again had one more seizure and there is no precipitant, then we call it epilepsy. This is as simple as this. So all the seizures are not epilepsy. I give you another example. Sometimes there is a low sodium in the body and that causes seizure. We don't call it an epilepsy. We call it situation-related seizures. See, if I look at the common causes, in children we have to divide. The newborns and in first year, the common cause is electrolyte imbalance, fever, infection. These are common causes, which are usually not inherited. After that, some of the syndromes which are inherited. So I think it's a very small percentage of children, 10 to 15% are children who have seizure which are inherited. So you also find sometimes family history in parents who have seizure and then the child is having seizure. But I as a general notion for public, I would say usually seizures are not non-hereditary. If you look at the common cause of seizures in India, what are the common causes? Common cause is neurocysticercosis. So it's an acquired infection of brain. There is a small insect which whatever you eat, especially raw vegetables, and this insect egg goes in your stomach, and when it reaches brain, it causes seizures, and that is called neurocysticercosis. This is a very common thing. In children, CNS infections, bacterial meningitis, tubercular meningitis, encephalitis, these are another common reasons why you get seizures in children. Again, there are non-inherited things. Some of the inherited things are like juvenile myoclonic epilepsy and some of the epileptic syndromes, which are very, very uncommon. They are inherited. So let me tell you, you can have seizures from at the time of birth till you are alive. So no age is practically spared. But as I mentioned at the beginning of my talk, the children and elderly above 55 or 60 years are higher chance of having seizures. If I talk about small children, 1 year, 2 years, sometimes very subtle symptoms. Child may be irritable. Child is not feeding well. Child is not thriving well. So child is vomiting. Child is looking abnormally on one side. Child is not giving attention. So these are very subtle things which can look like a seizure. So parents may not be aware about it. So for especially children who are less than 2 or 3 years of age, I would say if you find anything new, which is not usually you are seen in children, then you should talk to your doctor and explain what is happening. Whenever you see something like this, now everybody has a mobile in their hands. Please video record that event. Because the event which you will go and explain to your doctor will be different understanding than if you show the same video to the doctor. And also I must give a little instruction about video recording. Don't focus on the face. Stay 3 to 4 feet away from the child and record. Let him do whatever he's doing. Ensure that the child is safe. So if you show this video to any of your treating doctor, that will help him great length to decide first, is it epilepsy or not? If it is epilepsy, then what kind of epilepsy it is? I give you another example. Parents will come and tell you, then when he gets seizure, he turns his head to the one side. And he keeps on telling, no, it turns the head to the right side, turns the head to the right side. But when you ask parents to make a video and when they come back, the child is turning to the left side. So the entire diagnosis becomes different. So first I will tell you don'ts. The most important don't is don't put anything in the mouth. Do not put your finger. If there are two seizures, the child will bite your finger and it will go seriously. Don't put any hard object in the mouth because they will break their teeth. Don't put water because likely it will go into the lung and cause serious pneumonia. What you need to do is ensure the child is or the adult is breathing normally. So breathing is good enough. If breathing, whether it's breathing slowly or rapidly, is okay. If required, you can hold the hand and leg and turn them 90 degrees. When you turn them 90 degrees, the saliva from the mouth will drool outside, which is good enough. Most of the seizures last 2 minutes. And within 2 minutes, child will stop throwing those abnormal movements, and 2 to 5 minutes, child will get consciousness. So don't panic. When you panic, you create more damage. When the child is having a seizure, you try to lift it and not causes damage. So let him be there and wait for 2 minutes. If the child is hitting the hand or leg or head to the wall or any neighbor object, just remove it from there. Practically every epilepsy is treatable. 70% epilepsy can be treated by 1 or 2 drugs. Another 10 to 15% of this epilepsy can be treated by more drugs, and some of them may require a surgery. Now there is a very lot of advancement in epilepsy management. Now you can detect even a smaller change in the brain structure that may be responsible for seizure. And now we have wonderful MRI techniques. You can detect those abnormal brain area, and you can remove that, and you are seizure free. So lifestyle modification is you should not drive. Second thing, if you're on medication, you should not go for swimming or adventurous sports. For example, if you are doing an adventurous sport and if you unfortunately get a seizure, it can harm you seriously. So simple living, eat on time, sleep on time. Sleep is a very important factor for prevention of seizure. Especially when you're on medication, it becomes paramount. If you're not on medication, in the past you had an epilepsy, your sleep, you have to always take care of it. So if you have to attend a night party, so you sleep for 2 hours in the evening time. So you will cover that time, your sleep will be better, so likely you will be safe.